Hello everyone, I will be presenting part 2 of our medication error prevention presentation. In our fourth study of McCannon 2017, he conducted a study to provide a strategy to reduce medication errors and improve patient safety. The purpose of this study was to investigate if using medication safety vests and signage, such as "Do Not Disturb" signs, reduces interruptions in order to reduce the amount of distractions nurses experience during medication administration. The sample population consisted of 28 registered nurses on a 28-bed medical surgical unit. Registered nurses completed a pre-test post-test called a Medication Administration Distraction Observation Sheet Survey, which identified 10 sources of distraction and interruption. An adherence survey was used as a tool to evaluate adherence to the medication safety vests during 12-hour shifts every day by completing the medication safety vest compliance report for the 4-week period. A third survey, the perception survey, was given to RNs after the project was finished. The survey reflected RN perceptions of the medication safety vest, signage, and educational sessions. Data was collected from the Medication Variance Reporting System, which tracks medication errors in the hospital, and was evaluated for 3 months before the program and for 4 weeks after completion. Amado's survey, the survey results, both the pretest and the post-test, the adherence to safety vest use, and perceptions of medication safety vest and signage use. Educational sessions data were reviewed and analyzed by the project leader. In our fifth study, the authors conducted a study aiming to explore nursing students' experiences and competences with technology-driven medication administration processes. The purpose of the study is to show that by teaching nursing students new ways on today's medication administration will help prevent medication errors. 62 students completed the training. In this study, 2 focus groups were created. The researchers interviewed the focus groups twice. The first interview was done immediately after the participation in the medication training as the baseline. The second interview was done 10 weeks after participating in the program. 5 themes were identified in the interview guide, which included interruptions, information and patient guidance, EPM, PDA, information on patient status and appearance, and interaction with the patient. 4 project group members reviewed the analyzed data while consistently comparing to make sure the meaning would target the mentioned 5 themes. Depending on the students' statements, the researchers categorized them into 3 general categories: patient safety, technology, and professional identity and professionalism. The authors of our 6th study conducted a prospective observational study aiming to explore the impact of barcode verification on error identification and recovery during medication administration. For the purposes of this study, 25 emergency department nurses at Bay State Medical Center participated in 50 observed patient scenarios, 2 per RN. Students volunteered as actors, which served as patients, and were trained on what to say during each scenario. Nurses were told that they'd be evaluated on the use of barcode emails during medication administration. However, they were not told that specific patient ID and medication errors were embedded in the simulations. Only in simulations could specific errors be embedded to observe nurse behavior. To determine which specific patient and medication identifiers the nurse used during simulation, all nurses wore an eye tracking device called the Applied Science Laboratory Mobile Eye. Nurses were asked to administer medications with the embedded errors. After the simulations were completed, 2 independent observers analyzed the video recorded material and recorded whether or not the nurse looked at each patient identifier. Implementing effective technologies to assist nurses in this process is crucial in order to reduce the number of medication errors, especially those related to incorrect patient identification and medication verification. When we looked at the findings, we found that in Study 4, Medication Variance Reporting System results identified an 88% decrease in medication error rates after implementing the medication safety vest. 82% of nurses do not disturb signage in the patient's rooms was always or often effective. In the medication areas, it was effective 89% of the cases. In Study 5, researchers were able to identify students' main concerns and split them into 3 general categories: patient safety, technology, professional identity, and professionalism. In Study 6, it was found that 84% of the nurses indicated incorrect medication before starting medication and did not administer it. 19% of the nurses who identified the incorrect medication also identified the patient ID error. 16% of nurses failed to identify the medication and/or ID and administered the medication to the wrong patient. 46% verified the patient's name to the patient's name on the medication label. All nurses used the barcode identification system to ID the patient. Using the barcode EMAS verification system reduced the percentage from 39% to 16% of nurses giving medication to the wrong patient. Wearing safety vests and signage during medication administration in order to decrease the amount of distractions the nurse experiences, therefore reducing medication errors as suggested by McKinnon, is an excellent idea to implement at hospitals. Nursing schools is where nurses are introduced to a medication world and is where all the mistakes need to be made. Nursing students need to be taught new ways on today's medication administration, which includes technology that will help prevent medication errors. Education intervention on preparing and administering parenteral medication will help in decreasing medication errors as well. When nurses know how to calculate their doses correctly, have confidence but are cautious at the same time, medication errors rates will go down. This study proves that education intervention is effective and should become a requirement for every nurse to participate in to serve as a teaching and refresher tool. As nurses, it is our duty to give our patients the best care we possibly can, while being effective and providing holistic care. The purpose of the research was to determine if nurses are able to increase patient care effectiveness by making less medication errors when given preventative measures as compared to when not receiving these. We need to apply any preventative measures we come across with. By educating ourselves in prevention methods for medication errors, we will be able to significantly decrease the number of errors in practice. By doing this, we will not only be increasing patient care effectiveness, but we will also be saving lives.